Welcome to today's press briefing. Today we have Dr. Chen Shuk-Kwan, Head of Communicable Disease Branch of Center for Health Protection, and Dr. Larry Lee of Chief Manager of the Hospital Authority. Dr. Chen, please. Good afternoon. Last night, we have 1,347 positive cases. 1,345 cases are local cases, of which 14 of those carry L425R and 1,283 carrying the Omicron strain. About 50 of those cases still pending to be investigated. And we have 8,300 cases of local infections. Its distribution. The majority of those, the male to female ratio, 0.83 to 1. More female than males. The age is down from 1 month to age 104. And those under 18, about 14%. And those older, 60 or above, 11%. Altogether, about 55% had two double dose. And separating Omicrons to other suspected Delta cases, as most of those are Omicron. For the Omicron cases, the median age is younger at 39. And those suspected Delta cases, the median age is about 50. For the suspected Delta cases, the percentage is about 24% are 65 and above, and those under 18, 8.7%. And the suspected Omicron cases are about 15 of those are younger than 18, and those 65 and above, 10.6%. For the Omicron cases, 55.4% of those had 2 doses, and those suspected Delta, 49% with 2 doses. And like I mentioned before, there are more cases in Samchebu, Shatin, and Tuen Mun. In January, it was Kwai Ching, Wong Tai Sin, and the islands. For the 7-day average of local cases from the 6th of February to 7, there are about 200 cases, and to the 9th, 400, and the 11th and 12th, about 800 cases. For every 2 or 3 days, the caseload doubled. It has to do with the highly infectious nature of the Delta variant. For the elderly residential homes for the elderly, we are receiving more reports of outbreaks involving both residents and staff. We are following up with them. For the elderly homes affected, these are the following: and Sen Kai Yuen Long Ha Chun and Ching Chung Kun elderly home was investigating for any close contacts. Fu Hong Wei Lang King Seng Yan Fan Lin Zhong Sam in Chinese. There are some confirmed cases, quite a number of those. Thus, all the staff residents will be sent to quarantine. And for the Fu Hong Society, at Adult Training Center, we have some preliminary positive and confirmed cases. We are currently looking into Shanpo Gong Shenling Street with preliminary confirmed cases. Song Ling Dak Feng Lo Yan Yun in Chinese. We have quite a number of confirmed and preliminary positive cases. Chi Wen Shan Chong 岭马里无勒中心 in Chinese, we have preliminary positive case. And in Chinese, 香港新健協會樂容軒 with some preliminary positive cases. And Fan Ling in Chinese, 龍富嶺中心 we have some preliminary positive cases. And Taipo in Chinese, 嘉義護理中心 we have a clerical staff preliminary positive. New Life Chin King hostels in Chin King Estate Treatment, we have some preliminary positive cases. We'll investigate. For the Baptist Oi Kwan Social Services, the Midway Home in Yok Kwan House, some preliminary positive cases. We will monitor the situation. And we have more reports of cases and outbreaks in various residential homes, and that's the end of my report. And Dr. Larry Lee, and good afternoon. As of 9 a.m., we have 3,400 confirmed cases receiving treatment. About 1,300 of those in public hospital, and 2,100 of those is North Lantau community treatment facilities, as well as the Penny Bay quarantine facility. Since we have too many admissions, the number of discharged and the situation of other patients are currently being compiled, and we will provide you with definite figures later. We have 3 patients in a critical condition, including an 84-year-old male in Cheung Kwan O Hospital, case number 14814. He was unvaccinated. A 79-year-old male in a Yanchai Hospital in case number 18489, and a third person, 80-year-old male in United Christian Hospital, case number 20463. For the last 2 patients, they were vaccinated. The one preliminary case of a 50-year-old girl in a critical condition. She is now in the Children's Hospital ICU. And I would like to make an urgent appeal to the public. Currently, the number of confirmed and preliminary positive cases in the hospital have exceeded our capacity. Our current isolation facilities are now fully in use, and the recent a lot of cases of children and the elderly that need to be admitted as soon as possible. In order to ensure they can get treatment as soon as possible, and to ensure that the healthcare system will not collapse, we will adopt the following urgent measures. We will implement the new confirmed cases criteria. The isolation beds will be reserved for serious cases, the elderly and the children. Will accord priority to these classes of patients to be admitted. We will gradually turn the Hong Kong infection control cases, stable cases, to the Asian World Expo community isolation facility to vacate more beds to receive the elderly and children. As for the younger and more stable and mild symptoms, please wait patiently at home, and we should reserve the medical resources for those most in need. We'll try to support them through telephone hotline, and we'll come up with other options to solve their treatment options. We're proactively working with the government to add more isolation facilities so that we can add the number of isolation beds within a short time. We're also redeploying the manpower. As soon as the spaces are ready, our medical personnel will be stationed at the new isolation facility to receive more patients. We will gradually reduce the non-emergency service in the hospitals, and checkups and outpatient service to divert resources to cope with this crisis. If the conditions further deteriorates, we won't rule out suspended some of the regular service at hospitals in order to turn some hospitals into hospitals specialize in receiving COVID patients. Hope the public can understand and support our decision, especially those balloon positive cases that yet to be admitted. I understand you are feeling anxious. However, in the face of crisis, we must put the medical resources for those under serious cases, the elderly, and the children. I assure you that the Department of Health, the HA, and the Pfizer department has devoted all they have in working around the clock to arrange admissions. And once again, when I appeal for those who are in a stable condition, please wait patiently. If they try to call an ambulance to the hospital, they only add to the burden of the anti-epidemic personnel and even delay the treatment of other COVID-19 patients. I sincerely hope that you can listen to our appeal and heed our appeal. In the face of crisis, please all work together to think of the greater good and reserve the most unmet resources to those most in need. And let me reveal about the balloon positive cases in HA. There are about 40 staff balloon positive cases. Most of them are in social or household exposure. About 20 of those are listed as close contacts. And through screening, we found 8 patients at balloon positive. About 20 or so of the patients in the same ward are classified as close contacts. And for the details, I would release it through the press releases. We're now open for the questions. And please introduce the media represent.
This lady on the right. I'm from Now TV. I'd like to ask about the critical 3-year-old girl. When was what was a number of children are in critical condition. Even one died yesterday. For the proportion of children who are infected, has their percentage gone up? And also, what about the percentage of beds being used by children? Is there any sign of inadequate provision of beds for children, especially children who are waiting now for admission into hospital? And also, on the triage arrangement for patients, you said that patients with mild symptoms should remain at home. Is it that you are actually expecting people to stay home for treatment? So do you know how many people are being stranded at home waiting to be sent to hospital? Because there have been cases where patients stuck at home have infected their family members. Is it that we can no longer suppress the transmission of the virus? And thirdly, I'd like to know about, just now you mentioned in Shamshipo, Sha Tin, Tuen Mun situation is quite serious. Can you brief us on the proportion of untraceable cases in those districts, or in which districts is the situation harder to control? There have been information or news that the government may impose district-wide lockdown. What does the Center for Health Protection think of such approach? On the 3-year-old girl in critical condition, on the 12th, she went to the Prince of Wales Hospital and Union Hospital. She was admitted to Prince of Wales later on, and her condition deteriorated, and then we transferred her to the Children's Hospital ICU. Right now, she is not using any artificial lung. And for pediatric patients, we have not got a percentage of them in proportion to overall number of patients, but for the overall negative pressure wards, the usage rate is now at saturation point. And as I said, in terms of arranging for patients to go to hospital, we know that priority should be given to those with serious symptoms. So besides hospital wards, we would try our best, all we can, as I mentioned earlier on, to vacate North Lantau Infectious Disease Control Center and try to provide more beds there to receive the patients, and also assign more nurses and pediatric doctors to go there. For young patients in stable condition who are at home, I cannot give you an actual figure, but I believe that there will be thousands of them in that category and who are resting at home in the community. And we are providing them with hotline support. For those who remain at home, we propose that they should pay attention to personal hygiene and to avoid any environmental contamination. We did an analysis earlier on the fifth wave, the local cases, and the age distribution. Before the fifth wave, there were very few children cases, so we could not really make a comparison. Now, currently, about 4% of the patients are under the age of 4. So from the pediatric specialists, these children could suffer from complications. As for Sham Shui Po and other districts, according to the addresses provided, most actually cases are found in those districts you mentioned. Cases which are epidemiologically linked, or those who are not linked, they have been found in those districts, and some may be close contacts. Next question, please. This gentleman at the back. Good afternoon, from TVB. We can see that, well, on the cases themselves, the Fuhong Society and Songling Society, is it because their staff went to different premises, therefore they infect one another? Or is it because of the high transmissibility of the virus that they actually end up getting the virus? And also today you can see that the specimen collection stations, there are few queues now. And one of the reasons may be the drop in the number of people subject to compulsory testing. So I'd like to ask the Department of Health, would you actually abandon the policy of asking people to go for voluntary testing? Is it because of the limited capacity for testing? And also Dr. Lee just now suggested that because of the short provision or supply of beds, you are encouraging mild patients to stay at home. But for people who are staying at home with symptoms or mild symptoms, if they're waiting to be sent to hospital or delay being sent to hospital, that will increase the risk of them infecting their family members. So would HA have any suggestions on, like, for patients in stable condition, what should they do and what can they do to reduce possible infection of their family members? And also, how serious is the delay now in people being sent to hospital? How many of them are being stuck in the queue, waiting to be hospitalized? The elderly homes run by the organizations concerned, we're not sure whether their staff go to different elderly centers run by the same organization, but they could actually have been identified as infected because they went for testing at the same time. And compulsory testing. Well, yeah, because previously there were a long queue in various places, so we tend to actually test people living in places with outbreaks first. And maybe when people see that the queues have shortened, then they may, if they have been to high-risk places, we will hope that they will go for testing as well, now that the queue is shorter. Now, you mentioned there are some cases found. Well, there have been cases found in the community. And earlier on, I've mentioned several times that it's not an ideal decision, but in this critical moment, we need to reserve our limited medical resources to patients who are most in need. So therefore, those in serious condition and elderly would be given priority to be sent to hospital. Those who are remaining in their homes, we will suggest that they maintain personal hygiene, wash their hands frequently, and wear well-fitted mask, or you can put a cloth mask on top of their mask, surgical mask. And they should clean their room or house, a home every day, and using bleach, and also ensure good air ventilation in their home. And if they can, try to remain in their room as much as they can to avoid having meals together with the family members or having any intimacy with any family members. And I think that with good infection control, we can do a better job.
Let's have the English question.
A few questions from RTHK. Given that there are thousands of COVID patients staying in the community, would it trigger more outbreaks? And do you think the pandemic is getting out of control even with current social distancing measures? And also for the 3-year-old preliminary positive COVID patient in critical condition, is her situation still aggravating, and how is she going to use an artificial lung soon? And why does this wave of COVID see particularly great impact of COVID on kids? Thank you.
Okay.
Maybe I'll speak a few words first. I think if everybody try to reduce contact with other people, of course you can reduce contact with your households. Then the inter-household contact will be reduced, and it is possible that the infection rate can be reduced.
Okay. For the 3-year-old girl, and she's currently in the Hong Kong Children's Hospital Pediatric ICU. And I will know that the patient's situation is worse, that need a artificial lung, or we call it ECMO. But I don't have any further information about that. For the care of the pediatric patients, as mentioned, they will be one of the needy group that need to be admitted. So as I mentioned before, the strategy, we will try to reserve the hospital bed and also some of the bed in the North Lantau Hong Kong Infection Control Center, and try to make sure that patients can be admitted in due course.
Next question, another English question.
Good afternoon from SCMP News. May I ask how many prelim positive cases are there for today, and for if there are any figures, is this figure delayed? Can I also ask any update on how many children under 5 years old are being hospitalized, how many are in serious and critical condition so far? And for the elderly homes, how many are under the Home Safe scheme, and how many elderly homes are involved so far? Do you see that even with medical resources reserved for, the serious cases like the elderly and children, do you feel that even with the allocation to the more serious cases, hospital beds may still be oversaturated? And also wondering if the government is it feasible to consider district by district lockdowns with the rising number of cases? Thank you.
Around 2,000 preliminary positive cases at the moment. The Stay Home Safe scheme, we have 4,000 as of midnight last night. 4,317 persons of 1,904 household units are under home quarantine.
Okay. So we don't have any exact figures for cases admitted in the hospital less than 5 years old. But according to our record, there's only the critical cases which is age less than 5 at the meanwhile. For the pediatric cases caseload, I'm not sure about the number that will be going to be, but I think the admissions of the pediatric case sometimes is a bit complicated with their family configurations. So rather than the true capacity of to be enhanced to help such pediatric patients, we also work out some logistics, including in the Penny Bay and also in the community treatment center, to try to accommodate confirmed cases who is in a family cluster to be staying there. And I think this is one of our direction to help to ease the pressure.
下一題，前邊近中間。
The lady closer to the middle row. Phoenix TV News. For the Sam Shui elderly home, 9 staff self-test themselves positive, and they waited for 6 days before being picked up by an ambulance. When I know the details, according to the current testing capacity, some experts suggested that an MTR to establish testing stations to facilitate the elderly and everyone else. and to train like this beauticians to help with the testing. Will you consider this? I think you're referring to the one living home for the elderly. The address they reported was the elderly home. So they were quarantining at the elderly home. As well, since we received some feedback, and today we got in touch with them, that and we'll find out if they want to switch to another place for quarantine. I know that they've been tested positive from the rapid test. However, they are not being yet. Therefore, we will arrange them to serve the quarantine in Lee Yimun. The reporter in the front. Cable news. For the Ngao Chi Wan, Choi Wan elderly home, over 20 residents rapid tested positive. Has the HA random manpower to conduct testing, and some of the residents were rejected into return to the elderly homes. However, their partitions are not completely sealed, and when can you arrange other elderly residents to quarantine? For the case number 19575 was discharged the day afterwards. 14714 and other cases where they discharged and heal on themselves. Well, do you have any preliminary plans to set up COVID patients-only hospitals? And do you have another critical children case at the Queen Mary Hospital? And can you tell us in Chinese how many children are confirmed? For the preliminary positive case in elderly home, in the case of an outbreak, they will need to be admitted to hospital since there are suspected cases. For the number of confirmed children cases, we do not have them at hand. We can supplement later. For the COVID-19 hospital, we yet to have a concrete proposal. At this stage, we hope to accord priority to the 3 classes of patients to make sure they are admitted. For example, like say the North Lantau Infection Control Center. Next question. On the back row. Oriental Daily News. Yesterday, how many elderly homes residents need to be evacuated, and how many of them are evacuated? And how many elderly homes will need to have served the quarantine in premises, and what is the maximum number of cases in a single residential home? And this morning, Secretary Law Chi Kwong mentioned that the staff and the residents in the residential homes, if they tested negative on the 8th day of their quarantine, they can shorten their quarantine. Does that mean after 7 days, if it tests negative, they can return to the residential home and go in and out freely? Since the elderly are a high-risk group, is it in line with the government anti-epidemic policy? What is the scientific basis for that? When under the right conditions, that the residents can stay in the residential home to serve out the quarantine. So what are the conditions? Well, today we have reported over 3,000 cases. Is that because due to accumulation of preliminary positive cases from earlier, which contribute to the exponential growth in caseload? And for the hospital authority, that you mentioned that you might suspend regular services. Under what conditions will you implement this? What are the conditions? Will you even suspend the emergency services?
Okay, let me answer first. About 20 elderly homes have residents that have been evacuated. Numbers vary from one home to another. As for which elderly home has most infected cases, we don't have the figure yet. And one has the residents being quarantined on site. Well, quarantine on site can happen if the home is more spacious, well ventilated, air change is frequent enough, and infection control is well done. In the actually Asia World Expo, quarantine places for elderly are in short supply, and for most Omicron cases, the incubation period is relatively short. So we hope that elderly people can be quarantined as soon as they can. And in the first 7 days after they've been subject to various tests and if the results are negative, when they're back in the home, they still need to be under supervision and observation and do frequent testing to see if any positive results come up. For the 7-day quarantine period, after that, the chances of infection would be lower. Right now, we have reduced non-emergency services at hospitals, and we would largely reduce non-emergency services, including non-emergency surgeries, appointments, and medical consultations. For a community treatment facility and also North Lantau Infection Control Center and also Penny's Bay Quarantine Center, our goal for them is that we would not affect the provision of emergency services, which are a core service. We must insist on providing them. At the back, this person in white from AM730. Just now you mentioned that in terms of cases, well, have you been able to locate the sources of any cases so far? Or have you given up on tracing the cases? And how many cases, review cases are handled each day? Is it 1,000 or 1,500 a day? Do you have the latest figure on people staying home who are infected, waiting to be hospitalized? And for hospital authority, besides the 3-year-old girl, are there any children in serious condition? Whether you have the numbers or not, can you give us their latest information? And there are people waiting who waited at home and recovered before even being sent to hospital. Do they need to still be sent to hospital even though they've recovered? Would they be spared from being hospitalized so that you can reserve more resources and also have ambulances be free up to take other patients to the hospital? We are still carrying out with our epidemiological investigation, but our prime task is to send confirmed cases to hospital and to test close contacts. As for whether the sources can be found, it's really not we need to know the most, because we do want to isolate the cases and protect close contacts first. About 4,317 people are under home quarantine. About 27 actually have positive results in the rapid antigen tests. I should say 72. Sorry, it should be 72 tested positive by using the rapid antigen test, and they should be preliminary positive. In other words, so they have to be sent to hospital. And they're waiting. I haven't heard from our laboratory about any limit on the number of cases they can test a day. But of course, the workload is huge now. For serious cases, besides the 3-year-old girl I just mentioned and the 4-year-old boy who passed away yesterday, I don't have any serious children cases now. For patients waiting at home, I know they have to bear with it, and we will discuss with various government departments on the way ahead. But in the past, even during the swine flu season, we also opened community facilities, clinics to help patients in need. And we'll announce the details to you in due course. Gentleman at the back. From Ming Pao. On the whole, may I ask, Dr. Zhong, you said that preliminary positive cases, no, now, of this category of patients, how many are waiting at home for treatment? And also, Penny's Bay, Asia World facility, and also the hospital was and the numbers of patients at Penny's Bay. Would you have the figures, updates? And also for the 3-year-old girl, did she have any other diseases? Did she actually have signs of lung failure? And you said that she was admitted to a private hospital. Is it because she could not get a place at a public hospital? You said she also had been to Prince of Wales Hospital. Do you know why her condition deteriorated so much in a short period of time? What sort of virus variant was she infected with? You know that pediatrics, involves complicated, arrangement. So if there are more pediatric cases in the future, would you have any arrangement in terms of allocating resources or to vacate more hospital beds to cope with demand from this group of patients? And how many patients are using artificial lungs now? And also for pregnant women, in the fifth way, how many pregnant women were affected? Is there a pregnant woman in Kew Elizabeth Hospital actually seriously infected? And also the vaccination rate of pregnant women, would you have that? And have there been pregnant women who are infected and who also have given birth? Have any of the newborn babies been found to have been infected? On the whole, HA, as I mentioned, has about 3,400 confirmed patients receiving treatment at the hospitals. And the Tier 1, Tier 2 wards have been almost saturated. For Penny's Bay Quarantine Facility, by today, this morning, we got about 800 patients there. But all along, we've been transferring patients to Penny's Bay all along. And for the 3-year-old girl case, I think she didn't have any major disease. For other information that you asked for, I don't have it offhand. For admission of patients who are children, well, it's complicated not because of clinical issues, but because besides the age factor, it involves, family issues, and kids would be looked after by the parents. But sometimes we cannot actually admit all the people into hospital, so we just want to try to provide the best help we can for the families concerned. For ECMO, right now, Hospital A has about 20 of them. How many are being used? I don't have the figure. And also your question on pregnant women, I don't have the figure either for now. This gentleman there. Good afternoon. I'm from Hong Kong 01. Of the 3,000 preliminary positive cases, are they new cases or family members of confirmed cases? And also, when you think we can resolve the issue of people who tested positive and yet to be sent to hospital? In Wan Lun elderly home in Sham Shui Po, the staff there had waited 6 days before they were contacted by the government. And are you worried that this could result in new infections? And also, 2 days ago, the Hong Kong Macau Affairs Office announced that they would help build isolation facilities in Hong Kong. Would you know, has the location been chosen, and what is the plan involved? And now the number of people undergoing compulsory testing has dropped, but do you think that would actually undermine the goal of identifying cases at an early stage, or would you think that it's just fine to leave people who are infected at home? But employers have expected the employees to go back to work. So are you worried that under this circumstance, can we cut off the transmission chain at all?
Of the 2,000 or so preliminary positive cases, I believe that we have some household members and the community infection cases. Of course, I don't have the details for now. For the elderly homes, at the beginning, they were doing home quarantine. Thus, their home would be the elderly home in this case, as they do not have any other addresses. As they found themselves to be preliminary positives, they were worried. Therefore, we got in touch with them and aware that they know that nobody admits anytime soon. That's why we transfer them to Lei Yu Mun. Well, the biggest challenge will be the lack of isolation facilities and hospital beds. As I said, this is unsatisfactory. First, we adopt two strategies. Well, we hope to relax the discharge criteria to vacate more beds. And we also do our utmost to boost more isolation facilities in order to admit more patients. The HA and the DH and the FST are doing their utmost in order to arrange patient for treatments. The gentleman at the back. News. Can you give us the number of preliminary positive cases? We all know that we are running out of isolation beds. Some LegCo members propose using converting facilities as isolation facilities. For example, it's like a Hong Kong Convention and Exhibition Center. Has the government considered such plans? Even though you've tightened the ban on the social gathering, however, you see a lot of foreign domestic helpers gathering on the street. Sometimes there are more than 2 or 3 of them. Are you worried that the infection will continue to spread? And finally, what can the HA do to prevent children from delayed from getting admitted, thus endangering their lives? There are about 2,000 preliminary positive cases. For the isolation beds or ward, every department are doing their best in trying to identify more beds. As soon as we are ready, the medical personnel will be stationed there to receive more patients. For the pediatric cases, there are challenges admitting them. We try to take a humanized approach. Besides giving priority to children and the elderly and the serious cases, in the North Lantau Infection Control Center will help as well, and the Asia World Expo Center would also help the family cluster cases. The last question. Hong Kong Economic Times. What's your estimate of the length of wait of patients before being admitted to hospitals? And would you handing out electronic bracelet to ensure that the cases will not go out? You mentioned that you will reduce non-emergency services. What is the percentage, and what are the services affected? For the critical cases, do they have any underlying conditions? For the 3 elderly, when are they confirmed and admitted? For the 2 vaccinated elderly, what brand of vaccine and when? Now that we have quite a number of serious cases of children infected. So why did they develop serious symptoms after infected? Is this virus particularly lethal to patients? May I know about their condition? Are they stable? We need to wait for some time before being admitted. If we have an infected children at home, what kind of advice can you give to parents and what you look out for? For those waiting to be admitted, we don't have a concrete figure. They will need to wait for a few days before being admitted. On the non-emergency services, we mentioned that the non-emergency surgeries and the consultations and checkups will be reduced. The different clusters will have different extent of reduction. However, it will be to a great extent. Besides the 3-year-old girl, there is no other serious children cases. Of the 3 cases I mentioned are elderly. 2 of them are vaccinated. I do not have information on the type of vaccine they received. But the other children cases are in a stable condition. That's the end of the press briefing. Thank you.